Wow. Just wow. Um, yeah, we're going to discuss WPATH, Marcey Bowers, non-binary, transgender slash transsexual, and mental health therapy for in the community. Um, Most all of us know that WPATH files has come out, and some things that were found out in there, can does lead the insanity of WPATH. Um, Although they do some good things for those who are trans, some of the stuff is just mentally irregular. Okay, some of those things is they want to make medical transition a human right and take out all of the safeguards, not gatekeeping, safeguards for mental health, and to ensure that this is something right for adults. Okay, they even want to get rid of from what I'm understanding, they even want to get rid of gender affirming therapy. Well, someone has to say, hey, I want this surgery done. Okay, it's not gatekeeping, it's safe keeping. 80% or more of children who start on puberty blockers go and cross over to trans-sex hormones would not medically transition if they had been left alone without the prescriptions to stop their puberty and be put on cross-sex hormones. Would not, 80% or more, would not medically transition. It's a fact. It's a historical fact. Every European country has found this out. American studies have even found this out. It's getting blocked by people in medical fields and WPATH. Where 20% who are put on these may not medically transition. Problem is, if they get put on these cross-sex hormones and puberty blockers, such as Lupron and the like, it's a 100% destruction of the reproductive system. Any child will say, hey, kids, ew, yuck, disgusting, if you ask them if they want to have kids. It's probably more than 90%. And the regret that comes along with it, because they will not be able to have their own children. And that's insane. It is. And that's putting it mildly and nicely. And I believe it's actually criminal. And it should be considered a criminal act to medically transition children. What they need is the proper mental health therapy, because it is a disorder. It is a mental illness for children and adults. I'm glad I didn't go to an affirming therapist when I first started my transgender medical journey, or before I started it. I got mental health therapy from this kind, caring, compassionate woman, and all that wanted to make sure this could be the right thing for me. And I was her first trans patient. So she learned a lot from me as well. And I learned a lot from her. Learned a lot about me. needed to know if it actually was going to be the right thing to the best that can be found out. And I made those decisions as an adult, and it turned out that it was the right decision for me to medically transition. I also went to the proper therapy to find out, ask those caring, compassionate questions about why I feel the way I feel, believe the way I believe, want to do the things that I want to do, and took an even deeper dive into some things that I may not have been thinking about. Okay. Children don't have any idea of what the consenting to this treatment actually is all about. All they have is a discomfort with their identity. And that's okay. As long as we as adults and parents get them the right kind of mental health therapy to actually help them look into what is wrong or what's going on. Now, maybe not necessarily wrong, but what's going on. Why they think and feel and believe the way they think, feel, and believe. Those things that help them sort things out so they can grow and mature to an adult, a caring, compassionate adult that can make adult decisions. And that when they have a better capacity to understand what they're asking for and wanting to do. I'd have been pissed if I was put on this stuff and wasn't able to have my own children. I'm glad I waited. And I don't know if I'd have been able to do it anyway. Grew up in the 70s and 80s, then that doesn't mean that I couldn't have had it done. Financially, it would have been extremely difficult, if not at all possible. And I think back then, there were actually mental health therapists that used care and compassion to find out what's actually really going on with children, mentally and emotionally. And that's a good thing. It really is. We need to move back to that. Help children understand who they are. And there's nothing wrong with questioning their gender identity. Most of the time, most people on this planet, more than 90%, their gender identity matches the way they were biologically born. So it does have ties to biology, strong ties to biology. There's only a few things that are gender attributes that are human-made. That is the color that men, women, boys, girls wear, types of clothes that we wear, whether we wear makeup or don't wear makeup, and things of the like that. Okay, those are man-made gender attributes. They're not the ones that they are the ones that do not normally come as a gender tied to biology normally. And what I mean by normally is in most of the population. Gender in most of the population of Earth falls into the biological sex they were born. So there's a genetic and biological component to gender and gender identity. There are a limited few. And it's a real thing that have a disassociation or hard time identifying with their gender or agender. Okay, my gender, male or female, is in the way I present in the world. Is it non-binary? And most children do not even understand what non-binary is. Okay. Then we want to talk about sexuality with kids. Well, if you'd asked me as a child if I was pansexual, I'm like, no, I don't have sexual pans. So those are for cooking. Um, a child. Most children have a strong sense of identity. Yes, it's true. I had a strong sense of identity and gender identity. I knew I was a male who a lot of the times wished I had been born female. I wanted to play with female toys, wear female clothes, wear makeup, present and walk as a female, wishing I would have been born that way. But confusion, primarily confused, yes. I had no idea what transsexual, transgender, non binary, or any of those other things meant. And I'm glad to an extent because it allowed me to be a child and use my imagination to get through life and have fun where I grew up at. Okay. I didn't grow up in a big city, grew up in a farm town. Didn't have cell phones, laptops, or computers. We had to use our imagination. Parents would go out and play. Use your imagination and I'll have fun the best you can. There's nothing wrong with letting a child do that. And if we need to get you help with whatever, we will do our best to get that help for you. And my parents did. Okay, being trans or gender nonconforming or like that, was kind of back then was 95% more intolerable than it is today. People got killed, injured, beat up, stigmatized, teased, bullied, and all those other negative things that come with it, identifying as something else, whether it be part of the lesbian, gay, bisexual, or even thinking else, well, I should have been born a male, somebody should have been born male or female, the opposite of what they were born. Okay? Kids can be good, kids can be cruel, kids can be very compassionate and loving and tolerant also. Most of the stigma and misunderstanding and the intolerance came from parents and adults back then. Okay. And some were not. Some were totally accepting, tolerant, and let their children, hey, explore your gender. Girls being tomboys, boys being Tammy girls, I guess, for lack of a better word, and explore with what they're going through. Not all of a sudden, okay, we're going to medically transition this child. If they knew what it was about, probably from larger cities they did, I'm sure. We're going to get into this WPATH thing here. Oh, my lordy. Like I said, they want to get rid of the safe things, safeguards. I want to say safeguards because it's safeguarding. Now the real mental health. Okay, and it's like, oh my good lord, and stated that it's just you know medically transitioning or kids making mistakes and wanting to detransition. It's just another part of the gender journey, so to speak. And those wanting to detransition. Quote from the president of from that wasn't. I don't think that was a direct quote from Marcey Bowers, although she may have said that or something very similar to that. Okay. Quote from Marcey Bowers: "Young people need to own up and take active responsibility for their choices, especially if they are permanent medical choices." Are you outside of your damn mind, Marcey Bowers? I thought you were a credible medical doctor. You know, children have don't have enough legitimate comprehension to understand the full meaning of what they're going through, even if and when they are told about it. They're not going to understand that. They're not going to retain it. They're not going to consider it important to know and remember. All they're going to know is, "Oh, I don't want children at that age. I want to change myself." You haven't ever heard of the children wanting what they want when they want it. That's all they want. Sometimes as children, and that means all of us who went through childhood, don't always know what's good for us. If we don't always know what's good for us, we should not be allowed to do those certain things, and this is one of them. Medically transitioning. Lupron, which is is used for rapists and sex offenders and child rapists and molesters to destroy their reproductive system and eliminate their sex drive. Are you sick? Treating him like a fucking pedophile. And yes, it's been used for certain cancers. Use it for that, because there are children that have certain cancers, and that should be the only reason why. And I don't necessarily always agree with using it for prepubescent puberty, where child starts puberty a little bit too early. I think maybe, I'm not, even though I'm not a doctor, just maybe, there's a reason they're going through that at an early stage. Just maybe. I've had some biology classes in high school and college. Although I'm not a biology expert, that's for darn sure. I do know these things cause irreversible damage that is not applause, not irreversible. And you know it. You know it as a fact. I had respect for you at one time, Marcey Bowers. It's dwindled greatly. You want to hold a child to the same standards as an adult. What is the matter with you? What's wrong with you? You need help. You need help. Yeah, I took some notes. Yeah. Talk about some of this stuff here. Another thing here too. They want to don't need the safety things because it's a human right and shouldn't have the safeguards. Really? Really? You can have both at the same time and not medically transition children. Have those at the same time. Because it's needed to make sure it's as best as possible the right thing. Children don't have the capability of making those kind of life-changing decisions, those permanent life-changing decisions. Why do you think they don't let children join the military? Because a life-changing situation about children joining the military is they can get killed. And guess what? You don't come back from getting killed. That's life-changing. It's life-ending. And it's been proven, too, multiple times. How many multiple times? I don't have an exact count. People transition. It's gone up 7,000% right from the WPATH files. Gone up 7,000% transitioning children and adults, mostly girls and women. Transitioning from one to the other. And they find out it's the wrong thing. You're the kind of barbarian that wants to take these safeguards away. Without that extra help to take a look. A heartfelt, caring, compassionate look to find out if these things are really needed for the person. You're sick. You're deranged. That's what I believe. I believe you're deranged, sick, mentally unstable. Yikes. I don't know. We need some kind of semblance of sanity, especially when it comes to our children. Does therapists and doctors like to say that children are exponentially committing suicide when they aren't allowed to medically transition, which is wrong, been proven wrong? The opposite has been proven to be right. Where they get put on these hormone blockers and cross-sex hormones, the suicide attempt and rate goes up after they get these medical prescriptions and procedures started. And you know this is true. Why? Other than you want to make money and you hate children. I believe you hate children when you do this to children. And there's a better way to do things with children and help them. There's medications called antidepressants and anti-anxieties. There's also this thing called, if they are still trying to commit suicide and they fail at it, they can be put in a medical facility to help them even more so they don't do this. You know this. Damn it, do the right thing. Treat people with the respect and dignity you want to be treated with. You know they don't have the capability to make these decisions. If you don't let them smoke, why? You don't let them get tattoos, why? You don't let them drink alcohol, why? Because you know it's damaging for children. Even though if they smoke, they start having problems with it, it can be medically taken care of if it's caused soon enough. That can be taken care of, yes. You start doing irreversible medical transitions, the treatments on these children, they are not reversible, and they're not reversible. But you're willing to let these children make these decisions to go ahead and do it, knowing they don't understand it. If they don't understand the other stuff, how are they going to understand this? Damn. You won't let a child under the age of 17 join the military, even with parental consent, because they don't understand what their decisions are about, or the effects of their decisions and taking action on them. But you let them medically transition and butcher the crap out of them. That's why I believe you hate children. There is a loving, caring, tolerant way to treat these children. Medications and surgeries are not it for children. I mentioned an exception or hinted towards it. 17 can be given consent to join the military. Maybe with parental consent, maybe starting medications for cross-sex hormone therapy, replacement therapy. I'd still rather them wait until 18 or older. It's just that I can see that as being acceptable, though, because the child has been able to develop more and have a little bit better understanding of what happens and what doesn't happen, what you can do and what you can't do after these treatments are started and these surgeries are done. One girl has a double mastectomy. They don't grow back. If the girl starting out transitioning has that done and decides that it wasn't right for her, they'll never be able to breastfeed their child ever. That's butchering of a child. Some have had it as little as young as 12 and 13 years old. I think Chloe Cole has told on interviews she had a double mastectomy done at 13. I want to say that doesn't happen in minor children. You a damn liar, and you know it. Non-binary people. I guess there's non-binary surgeries also. Non-binary gender confirming surgeries as well, to where those who are not identified as being non-binary can have either gender affirming surgery done, whether it be vaginoplasty done with the colon or phalloplasty done normally, the way it normally is done for female to male. So, I guess that's okay as long as you're an adult. Strange, I think. Doesn't necessarily mean it's wrong. And it very well might be the right thing to do for certain people, or they can have both genitalia, male and female genitalia. I don't know. I guess that means non-binary. And I still, the thinking is for me is still out on that one to grab a hold of it a little bit, see where it takes me and where it leads me to believe and think about it. Um, so I don't have a lot of opinions about that, other than if you're an adult and that's what you really believe you want and need to do, by all means, please go ahead if that's really what you think and believe you need to do. Especially if it's what may save your life as an adult. I haven't heard a lot of other things about that other than the surgeries for it. Whether cross-sex hormones or not, I don't know. I haven't heard anything that I can remember much of anything about it. So I don't have many thoughts about it. Although I still believe it is an identity only. Because there's no human that is really born non-binary, whether they're not female nor are they not male. Is still ending up staying that way, even though they do some kind of gender affirming medical treatments like surgeries. The biology is going to still remain the way you were born. I'm a transsexual woman, not a woman. I'm different from women, biological women. Getting medical treatments to align my body with looking as a woman. My biology to the core has not changed. And just through the cross-sex hormone therapy, my body is being told to do so different things. And then surgical things that have changed my body. Vocal surgery, I've had that done. Breast augmentation, I've had that done. I've got 2 more surgeries I want to go through. One of them's a little more intense than the other. Or one takes longer than the other. There's more procedures in one. One of them is bottom surgery. That's pretty much inverting the penis into a vaginal cavity or a wound to represent a vaginal cavity. Opposite for female to male would be possible phalloplasty, or just being into the testosterone for the clitoris to grow a little bit longer. I think that or a they call a metoidioplasty to add some length to the clitoris. All I know is that there's things about this that just don't seem right. And that's probably because they are not right. Like the medically transitioning of children, or whether it's a child or an adult, the affirmation therapy. Yep, you're trans. We're going to get you started on, if you're depending on what age you're at, starting you on puberty blockers, then cross-sex hormones, or starting on cross-sex hormones. And maybe with testosterone blockers. Testosterone is a heavy-duty hormone. All I know is without the proper therapy, which would not be conversion therapy and would not be affirmative therapy, Therapy that asks the person, and gets to the root of what's going on. That's called loving, caring, compassionate healthcare. That's the best way to go to start. It's the way it used to be. It's the way it needs to be again. But when medical transition has gone up by 7,000% or more, something's wrong. Something is just way wrong. Not even close to the right thing to do. Something is wrong. To go by that many. When transition and transgender, transsexual, gender dysphoria is less than 1% of the population of the world. Detransitioners used to be less than 1% of that. When you do the therapy the right way, you'd maybe see some that would detransition, but it was very rare. Now it's becoming about a daily occurrence, if not multiples in a day. Something does not look right with that picture. Something something about that picture says it went wrong somewhere. Just need to just come out back and figure out where, when, why, and how it went wrong, and try to figure out how to make it right again, or make it better. Especially when suicide rates go up, when puberty blockers and cross-sex hormones goes up, not down, goes up. That's a fact. Let's say I'm not a genius, but I watch things. I listen. I watch. I learn. And I retain it. That's sometimes that's a gift. Sometimes it's a curse to be able to watch, learn, and retain. Sometimes it's a gift. Sometimes it's a curse. I remember things. Please, let's have some more care and compassion when it comes to dealing with these issues. And I think that's why we all start on in these journeys, to help or look for help. Is to find some loving, tolerant, compassionate help. And then people who offer it, I think that's how it started, how they started in that, doing that. I believe that. Somehow it got mixed up on the way. Started going the wrong direction, and it's run off the rails. Very, very, very extremely few medical transition is right for. Not like the numbers we're seeing now. So seeing way too many people detransitioning, and it's the wrong thing to do, because it was actually the wrong thing for them. So we're not doing what we used to do. The safekeeping. Safety. Safe. We all know medical procedures the safest we can get. Sometimes things happen. We still don't need to do the affirmation therapy. Yep, we're going to start you on this. Or we don't have to do that. Nope, we're going to talk you out of it. We're going to try to come from a position of neutrality with it, to see if it's the right thing, or see if it's the better thing to do for an adult. It's not the right thing for a child, and we all know this. Because the puberty blockers stop puberty. It's not a pause, they stop it. It's one thing I remember before all this insanity started with puberty blockers. It's been a historical fact. And how do I know this? Mentioned it earlier. Convicted and repeat sex offenders, child molesters, and rapists. They use it on them to destroy their reproductive hormone reproductive system and destroy their sex drive. But you want to give this stuff to children? And you try to convince people who know for a fact it's a lie about being a pause? Please have some heart, have some care and compassion. Bring it back into your life. Because there are better things to do to help. People deserve that. Please. Okay. So now I've run out of things to talk about, things to say. And hopefully I'll have a wonderful day. Really, and I sincerely mean that. But y'all really do have a wonderful day. And if no one's told you they love me today, I love you. Bye for now.